We have a new class of drugs, the prototypical drug of which is griseofulvin. Now, it is not active topically. It's actually an orally ingested agent for skin infections. So that's sometimes kind of confusing to a lot of medical students. It's a skin drug, but it's not used topically. It's distributed to the stratum corneum, where it binds to various proteins. It should not be used in patients with porphyria because you can actually precipitate a porphyria crisis with this agent. In terms of how it works, it actually inhibits microtubule formation in the dermatophytes. It's a fungostatic, so it's absorbed into fungal cells through an active transporter. The toxicity of this agent includes headache and GI distress, fever, rash, and flushing from the histamine release that you sometimes get. Now, the other thing that's really important with this agent is that it will interfere with warfarin levels, so be careful of your warfarin dosing in your INRs when you start this medication. Terbinafine is available both in oral and in topical forms. Like griseofulvin, it is distributed to the stratum corneum where it binds to various proteins. It's actually much more effective than griseofulvin, and we see it all the time used in fungal infections. In terms of how it works, it inhibits squalene epoxidase. It accumulates there's an accumulation of squalene, and this interferes with ergosterol synthesis, and this is actually a fungicidal activity. Toxicity, once again, same as the other ones, headache, GI distress, fever, rash, and flushing from histamine release. And once again, this drug also will interfere with warfarin dosing and levels.